So we want to answer your questions today about the big story, swine flu. Dr. William Schaffner, who's an infectious disease expert at Vanderbilt University, is here to answer your questions. Dr. Schaffner, thank you so much for being here.
Oh, pleasure.
You know, we're hearing that there are such commonalities between this in terms of symptoms and the regular flu, and I know with the flu that we are all aware of, it's usually infants or toddlers and the elderly that we're concerned with, but this one really seems to be hitting a lot of very healthy people of all ages. So how can we tell which is which?
Well, we'll tell which is in the laboratory. But yes, in Mexico it seems to be hitting young adults, and we're waiting for more information there. In the meantime, I think we can take common precautions such as good hygiene and avoiding people who are coughing and sneezing that will prevent our getting infection.
Are there distinct differences between the strain that they're seeing in Mexico and what we're seeing here in the U.S.?
Actually, it looks as though the strain in Mexico and here in the U.S. are identical. And that's, of course, what has everyone alert both here and around the world.
Okay, I want to get to some of our viewer questions because our viewers have emailed us and they have some questions for you. First of all, Ashley in Quincy, Illinois wants to know, are the symptoms of the swine flu close to the symptoms of normal springtime allergies? Is there anything different that we should be looking for?
Yes, there's a big difference between allergy and the flu. Allergy, as you know, can give you a lot of sense of sinus stuffiness, eyes running and the like, and you don't get a fever with allergy. Whereas with influenza, you'll get a fever, cough, you can have a runny nose, sore throat, and this sense of really putting yourself in the bed.
Okay, so the fever is really a key distinguisher there.
Right.
Don in Reno, Nevada asks, if we see all the people in Mexico City and they have these flu masks, he's wondering where can the people of the U.S. and Reno also get these masks, and are they effective?
Well, the effectiveness question is a big one, and the CDC has looked at that, and it's out. We still don't know whether it's terribly effective. But if you want to try it, you can go to a medical supply store and they'll have masks.
Okay, good to know. Michael in Dade City, Florida has a question about media coverage, and he really digs into the history of this here. He says, why has there been no mention of the swine flu scare in 1976? Is it because the vaccine the government rushed out caused more damage than the swine flu? Could you clarify that for us?
Sure. Back then there was a lot of concern about swine flu, but not very many cases. We already have many more cases of swine flu in the United States and certainly in Mexico than we did then. And of course, we have no vaccine against swine flu yet this time around. Okay,
Dr. William Schaffner, an infectious disease expert at Vanderbilt University, we appreciate your expertise. Thank you so much for sharing it with us.
Pleasure.